Hi, I'm Josh. I'm one of the chiropractors here at Natural Healing, and this is our level 2 Kneehab video to help you restore the strength you need to get over an old injury. We still recommend you see a professional or ourselves to diagnose the knee and get a bespoke rehab plan, but this should be suitable once you've gone past the initial phases of your knee pain to start to strengthen and rehabilitate your knee. Some of these exercises might not make sense as to why we're doing them, but it all helps the biomechanics of the knee and restore your strength. We're going to start off with some calf raises. So find a wall, bring your hands shoulder height on the wall, walk your feet far enough back so that you get a bit of a stretch in your calf. Your heels may just start to come off the ground. And then look towards where the ceiling meets the wall to prevent your bum poking out. Then we're going to come on to the balls of the feet, into a full contraction and then a full stretch. Full contraction, full stretch. We want to do a high repetition of these. This is number 3. We're going to go to 25. Number 4. 5. Nice steady tempo. 6. 7. 8. 9. 10. Obviously this muscle is very important for us to propel ourselves when we're walking, but the squeezing of the muscle actually also acts as a pump to push the inflammation and waste fluid around the knee back up to the top of the body. 15. 16, 17, 18, 19, 20. 5 more. 4 more. 3 more. 2 more. Last one. Nice, you can give yourself 10 seconds or so to shake it off. And now we're going to have our back to the wall and lean against the wall. If you're on a hard floor, you might want a mat or a cushion down to press your feet on, and it can be a little bit uncomfortable if you're barefoot, so it might be nice to put some padding underneath your feet or wear some shoes. The further away the feet, the harder this movement is, and as you get better, you will be able to step away from the wall. And again, we go for 25, lifting the feet up and then bringing them down. The reason why we do such a high repetition of them is because we use this muscle all day, every day, so that rehab that we do has to replicate how we want to use the leg. 4, 5, 6, 7, 8, 9, 10, 11, 12. Nice and controlled. 13, 14, 15, 16, 17, 18, 19, 20, 5 more. If you're getting to this phase and it's easy, you're not feeling the fatigue, you need to step the feet away from the wall. Last 3, 2, and 1. Now, if you're really keen to get better quicker, pause the video and do 1 more of each of those sets. But if you're short for time, let's move on to the next exercise. Feet shoulder distance away from you. We're coming into a mini squat. We don't need to come too deep, particularly if the knee's still a bit sensitive. We're going to inhale, lower our butt down, bend our knees, have the arms to counterbalance, and exhale, we just come to stand. We're going to start with 10 of these. Inhale, 9, and come to stand. Nice and controlled. 8, 7, 6, 5, 4, 3, 2, keeping your weight even over both legs, and 1. Nice, so we're going to start on the affected knee, and now we're going to do a single leg mini squat. It's nice to have a hand on the wall just to keep your balance, and I'm going to start on my left leg if that's my affected leg, and my right leg is going to tap forward to 12 o'clock as far as it can and put a little bend in the left knee and come to stand. Again, we do high repetitions, little bend in the knee and coming back. It's easier if I do this. So keep your chest raked back to properly control the knee and develop that balance and stability around the knee. 20, 19, nice and controlled. 18, if you don't need the wall, use your balance. 17, 16, 15, 14, 13, How far forward can you go? Last 10. 9, 8, 7, steady tempo. 6, 5, 4, 3, 2, 1. Pause the video, do the other side. If you're short for time, you can just do the affected side. Shake off any tension that's built up. On this next one, we're going to do a bit of a release for some of the muscles that we're using. You can come into a forward fold and bring your hands down onto the floor. If you're quite tight in your legs, you can bring your hands onto the back of a chair or a table, or a cushion might help, just to rest your hands on. And we're going to do an elephant walk. The soles of the feet stay on the floor, and we bend one knee and straighten the other. We can let the upper body droop over, and we create some fluidity in the back of the knees. Again, we can do higher repetitions. So we're going to do about 20 of these to really bring back that movement of the knee. This is going to look different throughout the phases of your healing. So be kind to yourself and don't push it. Listen to your body. And we'll do another few more. Brilliant. Let's bring yourself down to the floor now. So this next one, similar to our level 1 Kneehab, we're going to be sliding the feet on the floor. So if you've got a hard floor like this, socks are fine, or a blanket around your legs. If you've got a carpet, a bin liner or a plastic bag around your feet will do great. What we're going to do, the feet are going to come nice and close to the hips, hands by your sides. You're going to lift the hips up, lift the toes up, and then with control, slowly lower the feet away from you. You'll start to feel your hamstrings work. Bending the knees to start off again, feet connect to the floor, bring your hips up, toes up, lowering away from you. And we're going to do 10 of these. That was number 2. Bringing the hips up, feet up. Number 3, we slide away with control. 4. 5. 6. 7. 8. 9. 10. Bring yourself up, bend your knees, and we'll finish the day with a bit of mobility for your hips. Listen to your knee. If it's still a fresh injury, some of the twisting can be a little bit aggravating, so please don't push it. Bring both knees over to one side, and we can look the other way. Inhale to the centre, knees go the other way, and we look the opposite direction. Brilliant. So you can dose these exercises to what your body needs. You can put more repetitions in or more sets in, but you can always reach out to us to work out a bespoke plan to help you along your healing journey.